Hi, my name is Crystal, and I'm a registered respiratory therapist. The way I became a respiratory therapist is because I was interested in finding a better career to better my life, and my friend introduced me to respiratory therapy. I looked up the requirements at Miami-Dade College. I went and registered, and I got accepted into the program. The respiratory therapy program at Miami-Dade College is 18 months, which is like 2 years. It does seem long, but trust me, the time goes by quick. Once I became I graduated the course, then I had to go and take my state boards, which I did. I passed on the first try, and I became a licensed respiratory therapist. So I have been a respiratory therapist for 10 years now. Wow, that's crazy to say. But I have moved up to respiratory supervisor. As a respiratory therapy supervisor, my responsibilities are, I still do bedside work, but my responsibilities are doing schedules, making sure employees know their job description, making sure they adhere to their job description. If there's any new trainings or any new equipments coming out, my job is to set up education classes to teach everyone, to make sure everybody knows what they're supposed to be doing to help take care of patients. A day in the life of a respiratory therapist is very exciting. You come in, you get your report from the day shift, whatever shift you're coming in for. You get your report from the previous shift. You have to know what has been going on with these patients during that shift, so you know what to expect on your shift from these patients. Some pros and cons of being a respiratory therapist is, well, we'll start with the pros first. Being a respiratory therapist, to me, is everything is very exceptional, because we deal with the lungs and the heart. It is a specialty that we have. We know what we have to do when we're dealing with the lungs to bring somebody back to life. The cons, in my perspective, is not really a lot of cons to me, because I love what I do. I love saving lives. I love being with somebody in their most vulnerable state when their family can't be there to help them. So being a respiratory therapist, I feel, is the best field out there, and I feel that's the best field that I chose to do. Okay, so as a respiratory therapist, once we get the report, you guys, we go to the floor, we see what medication the patients are on. When we start doing our treatments, we can give nebulizers, we can give MDIs, which is the inhaler, the puffs that you see most asthmatics use. We deal with asthma patients, COPD patients, anybody who has chronic lung history or acute lung history. Once we give our nebulizers, we can do CPT, which is clapping on the chest, depending on if they have a lot of mucus inside of their lungs. What we're doing that to get the mucus out. Also, as a respiratory, we deal with patients who are on life support. We work with different machines, the BiPAP, we work with high flows, and we work with the ventilators, which is the last resort when a patient is on life support. So if you hear life support, that means that they are. We also deal with patients who, if their heart has stopped, we have to bring them back to life. The way we bring them back to life is we do CPR, which we're compressing on the chest to bring the heart back. We pumping on the chest to bring the heart back. During that time, we're also, along with the doctor and the nurse, we're going to intubate the patient, which is we put an ET tube down their throat. This is to protect their airway and also to breathe for the patient. Once we have gotten the tube in their throat, we connect them to the ventilator, which is going to breathe for them. As a respiratory therapist, our job is to make sure we are monitoring their lung compliance. To monitor their lungs, we're checking for their peak pressures on the ventilator. We're checking to make sure the same amount of volume that we're giving them, we're getting that back, that there's no leaks between the machine and the patient during their time of being in a coma under sedation.